Welcome back, friends. Thank you very much for joining me. My name is Swadik Mayanja, and I am Q the Nurse, and we are on another episode of the Everyday Hero Show, where I interview someone in my life, or someone in your life, that makes us smile but does not get the credit that they deserve. And today, I am with Tiff. Tiff, welcome to the show, and thank you very much for joining me. I really do appreciate it.
Thank you.
Welcome, welcome, welcome. So, Tiff, just for the people out there, for those who don't know you, why don't you tell me and the people, who are you and why occupational therapy?
Okay. I'm an occupational therapist at New England Rehab Hospital. Mm-hmm. I've been working there about 3 years now.
Congratulations.
And I love my job. I love occupational therapy. I love that it's about what the person wants to do and needs to do and what's meaningful to them.
Yes.
To help them live their best life.
Yeah, and so like, I have to just put it out there. I did a very little bit of research. Not a lot, probably should have done a little bit more, but that's why she's here. That's why she's going to help us figure this stuff out. So I want to know the origin story. When I say origin, I don't mean like, yeah, sure, please tell me where you're from and the upbringing, but I want to know why occupational therapy, because the truth, Tiff, up until I became a nurse, and not probably even after nursing school, I really kind of, not even yet, got a understanding of what OT does. So I want to know why occupational therapy, but I want to know how you ended up getting there. So start from where you're from, but I want to really get to how you ended up occupational therapy.
Okay. Well, I grew up in Lowell, Massachusetts. I've moved a couple of times. I went to Quinnipiac University in Connecticut, which is a great school for OT. A lot of people don't know what OT is.
Yeah, that's a fact. That's a fact. Yeah, Q included.
Physical therapy gets all of the glory and all of the knowledge, but hopefully, this kind of helps get the information out there. And
for you OTs out there, come on the show. Come on the show. I'm sorry. Okay. Yes. Okay. So yes.
So when I was in high school, I volunteered at a hospital that my family worked at. I have a bunch of different family members who work there. And I was volunteering for some hours.
Real quick, as OTs?
No, okay. I have a couple nurses, lab tech, social worker.
Okay. So you volunteered there?
Yep. And I was in an adult day program where they were doing different activities to keep people occupied and kind of just get them to get off of the hospital floor and do something a little more fun.
Of course.
And so the woman who was leading the
group, the exercise
program, she was an occupational therapist.
And I mean, so what grade were you when this happened?
Ninth.
Ninth. And that did it for you?
Yeah.
That alone did it for you?
Yeah.
And like, honestly though.
So before that I had wanted to be a lawyer.
Oh my God. Oh, okay. So this is real. So that's a big switch.
Yes.
That's not like, oh, I wanted to be a nurse and now I'm an OT. I wanted to be a doctor. That's lawyer to OT. That's a huge switch.
It is. I mean, I wanted to do that for the typical reason of my mom would tell me I was good at arguing. So I did mock trial in high school and I liked it. But what really got me with OT is that you're actively helping someone do something that they enjoy every day.
Okay. And I understand that, and I'm lucky enough as a nurse that I have like the privilege of actually seeing it in action every single day. So let's just jump into you and getting in an OT school, because my nursing like perspective of this is that OT and PT are literally the same thing, and there's like a 5 to 10% difference in what they actually do. That's my perspective, right? So tell me, when you're going into OT school, where do you and PT separate? Is it like literally the last semester of your last year of college, or is it like seriously there's a huge difference? Where in school is the separation?
Well, right from the beginning, you take a couple of different classes. And at Quinnipiac, you can do entry-level programs. So right in freshman year, I was in the OT program, which was nice because then you can take OT classes all through the 5 years.
Okay. A 5-year program.
Mhm.
Oh, geez. Okay. All right.
And so PT takes like chemistry and more of like a kinesiology and basically the study of movement and like the biomechanics behind it.
Yeah.
And we graze over that a bit, but we focus more on occupations, which are daily activities and meaningful tasks that people do.
So I want to stop right there real quick, because up until I saw it happening at work, when someone says occupational therapy, I'm like, okay, so this occupational therapy is going to help me be a better nurse. This occupational therapy is going to help me be a better lawyer, because I thought occupation, work, like career, but it's literally life. It's like life.
Yeah.
Okay. All right. I'm sorry. I just
okay.
wanted to make sure y'all know what I'm seeing. Okay. So so
Yeah.
you guys separated. You do the lifespan of someone's life versus the kinetics of the movement. And then is this freshman year, sophomore year, junior year, or is it the entire time?
You start with like intro classes in the freshman and sophomore year, and then junior year you get into the specifics. So we learn all the different diagnoses, the backgrounds of neuro and the body and things like that, and then apply that to how you can help someone function at their best level.
Okay. And then, so as in a 5-year program, when you say junior year, do you mean the third or do you mean the fourth?
Yep.
Okay.
I went, they call it undergrad from freshman to senior year.
Okay.
And then we do an internship and then go back for one more year and then do 2 more internships.
Is the 2 more internships, is that an entire year, or is that just?
It's from May to January.
Okay, so it's not an entire year, but
Right.
it's basically.
Mm-hmm.
All right. Okay, so you get out of OT school. All right, you went to Quinnipiac, you loved it, you enjoyed it, you had a good time, you passed your boards. Congratulations, good for you. And then, so when you're applying to OT for an OT position as an actual job, when you at school, did you have to choose a focus? When you got out of school, did you have the option of going anywhere and they would train you there? How does that work? How does you as an OT that worked at the rehab compared to like an OT that works with pediatrics or newborns? When does that focus happen?
So you kind of learn what you like and learn what you're good at throughout school and throughout the field works,
Yes.
where you get to observe people. And the great thing about OT is that it does go from kids to elderly people. So you can do anything. You can work in schools. You can work at an outpatient clinic. You can work at getting people to get back to their jobs.
Yes.
So I always had an interest in inpatient rehab and more of the acute adult side of things.
Which is where you are right now.
Yes.
So you see yourself like you're happy.
I am.
Like you made it.
Yes. Yep.
Some of us are luckier than others. Well, okay. Well, congratulations.
But I worked at another job before this one.
Did you really?
I did. I worked at a nursing home.
I had no idea.
It was about 9 months, and I liked it, but I like a little more craziness, a little more.
The excitement.
Yes.
The
Yeah,
excitement.
exactly.
So let's talk about that difference between the nursing home and where you work now, because you said you like did you say the adult or the older adult? Which one are you more privy to? Or is it both?
It's both.
It's both.
Adult, yeah.
It's both. So because there's a huge, when you say adult, it's a huge span, right? So like you might meet the adult that is 18 plus, which is someone in their 25, 26, just starting life, and they had a horrible accident and they want to get back to, I want to be 100% and if not better. Right? Compared to the elder adult, which is like, I want to just be able to clean myself up and eat and live. Like, I want to do the bare minimum and just survive, like continue living.
Yep.
How do you, as an OT, like, when I want to know like your goals coming into a patient's room versus their specific goals. Where do you meet that? Like, how does that work?
I think that there's a big push in rehab to get people to be independent.
Okay.
So our goal is always to go in there with the idea that we're going to make them do as much as possible for themselves. And where you're adults, that you should have gotten down bathing and dressing and cooking and getting around your house.
Yes.
So we
Some
work
of us
on those.
still can't cook, but
Me neither.
that's another conversation. Mama, I love you. I love you, Mama.
Yeah, whenever they want to cook, I say you have to teach me because
Oh, goody.
I don't know.
Oh, goody.
But what I really enjoy, and I think it gets lost sometimes in a hospital setting because you're looking at getting people out so fast.
Exactly.
But I think it's very important and great when we can work it in when you're doing something that they want to be doing.
Yeah.
And whether it's taking care of a pet that you wouldn't think of working into your treatment plan, or being able to get on a bike or anything like that. I think that's... I remember in school, I had a professor who brought someone in, and he was a young kid, and he was college age, he got hurt, and he got... one of the stories he told us was that he got back to being able to go to college parties and play beer pong.
Oh, goody.
And, you can relate
That's
to
the
that.
goal.
'Cause, yeah.
Oh, that's the goal.
Yep.
Oh my goodness. Well, so he brought that person in, and
Right.
the patient actually told the story.
Right.
That's I mean that's real, and I have to say. So I worked with Tiff. We were on different units, floors. So I saw her once every 4 or 5 months. But I worked with her. We were in the same building, right? And you're right. I just switched over to a hospital, and my entire orientation, literally the entire time, everyone is like, the goal is to get them stable, right? And like that should most definitely be the goal at a hospital, to get them stable. But if you are an occupational therapist, if someone is trying to get stable and like a doctor wants them to be on a crazy sedation medication so they're not in pain, or if they want them to be on an antipsychotic medication so they're not losing their cool, right? Doing therapy in that period of time is not, that's not the time where you want to be doing therapy. So after they become stable, that's when you guys come in, and then you really get them from, all right, this patient is stable, but they lay in bed all day. Let's get them back to living, being a human being and doing what they do best. All right, and I love that. And I think it's great, and that's why I absolutely loved that I fell into working where I started out working, because I have the longer picture, like the bigger picture. Like I'm a very big picture kind of guy, and I like that. I like that aspect a lot. So let's get specific into OT, okay? Now you're at Health South and you're working right now. So when I see an OT at work, right, honestly, sometimes I see OTs grabbing the breakfast, lunch, dinner trays, right? And I'm like, what are you doing? That's speech's job. Sometimes I see OT walking with patients up and down the hall. I'm like, what are you doing? That's PT's job. Sometimes I see OT helping them and telling them, you need to use this med box, or you need to do this with your medications, or this is how you take. And I'm like, what do you do? That's my job. You guys do a little bit of everything, and it's really nice. So tell me, where are your guys' boundaries, or are you literally, I want to do everything to make the patient?
We have pretty specific boundaries. I would say, like, with speech, we don't cross over into swallowing. But with eating, we work on being able to hold the fork and bring the food to your mouth. And the nursing side, we don't give medications or prescribe medications or anything like that, but we can teach them a better way to take them, or set it up so that they don't forget to take them. And definitely in the inpatient setting, you do have a lot more overlap.
There's a huge overlap.
Yeah. And there's certain things you won't see the PTs getting anybody in the shower.
Oh, yeah. PT, you need to step your game up, all right? Nursing does that, the nursing assistants do that, OT. You need to work on that, PT. But, okay, all right. So, yeah, PT doesn't do that. And you guys do that. Mm-hmm. Regularly.
Yep.
Every day.
Yep.
All day.
Right.
So, I do love that about OT.
Yep.
I absolutely love that about OT, because OT helps nursing quite a bit. Mm-hmm. Quite a bit. Okay, so now when you're doing this therapy, right? How much technology, because I feel like OT literally has the coolest gadgets, You guys have the coolest toys. You guys have all the toys. You guys have the coolest gadgets. And when I last left Health South, there was this, I don't know if it was an electric thing that shocked someone's hand into moving. I don't know what it was. Maybe you know.
You got it right. That's it.
So you guys literally, so is it literally like every day when something cool comes out, you guys test it? How does it work when you guys are picking toys to use? Toys. I don't know what's the technical word, but you know what I'm talking about.
It depends on the person. It depends on how into the technology you are. The floor that I work on, the doctor doesn't always like new technology unless you can really prove that it's for the function and that it's going to help. It's not just for the sake of doing it.
Mm-hmm.
And we have things that range from low tech to high tech, as simple as reachers to get something off the floor, up to what you described is called the Bioness, which helps stimulate.
There's going to be a picture somewhere, but so you guys know what I'm talking about. But it's legit. Like when I saw it in action, I was like, "This is not real."
Yeah.
It's like I was like, "This is the future. This is life. This is amazing. This is amazing." Okay. So I think that's super cool about OT. So when you are working with patients, so let's get into the details. When you are with a patient, when a patient comes and tells you, "No, I'm not doing anything," what is your response? How do you react to that?
I think this is another part that is specific to OT, is that you can almost make anything therapeutic, because we also focus a lot on cognition and psychology. So at that point, I can sit down with that person and say, "What's wrong today? Why don't you want to work?" If it's pain, maybe I can give them some pain management techniques.
Mm-hmm.
If they're tired, talk about rest and getting enough sleep. Or they're feeling down, they just don't feel like it, we just have a conversation with them.
So you count all of that as therapy, and that comes under the umbrella of occupational therapy.
Yep.
And so if you were to go to more school, if that's even a thing, there is a way to specialize even furthermore in occupational therapy, correct?
Yes.
Okay. So can occupational therapy have their own practice? Is that a thing?
Yes, you can.
Like, seriously?
I'm not quite sure how it works, but you can definitely, yeah. So a professor I had, and a lot of places actually have their own sensory clinics where they have OTs mostly, occasionally a PT. You could run your own hand therapy clinic or outpatient clinic.
Do you have a favorite type of diagnosis patients come in with that you like to treat? Is it like either stroke, is it spinal cord injury? What is your favorite thing to treat, if there is?
I always thought it was going to be neuro of the brain injury, stroke, that sort of thing.
That's my people. Those are my people.
Which I do still love when we get the occasional person down on our unit. But I've really gotten really into spinal cord injury.
Yes.
Because we get that a lot.
And that's your floor. I mean,
right,
that's what you guys do.
Yeah.
That's what you guys do. And so when I say I love my nursing friends, and nurses, I'm not throwing you under the bus, but God damn it, I'm gonna throw all of you under the bus. Okay, so I just see therapy, and this is therapy in general, really, OT and PT. You guys have literally the best body mechanics I have ever seen. Like, when a nurse tries to be a booster patient, it's literally, let's get this done as soon as humanly possible so we can go on and do the next thing. But it is your guys' job to make sure these patients move correctly so they're not hurting themselves. Mm-hmm. Is this something that's just beat into, like, are you, in school, is this just constantly, you gotta do this way, all day, every day? Or is it just like, you do it because you want to be like, do as I do versus just do what I say?
With body mechanics, you definitely learn the textbook answers and what you're supposed to do. And when you start training, they do show you the best way to do it. But you find that when you are lifting someone correctly or having them move the right way, you both have less pain. You're not hurting your back lifting somebody up or anything like that. But seeing other people do it,
yeah,
you kind of learn a little bit more.
Because I'm just like, I've seen some of the worst body mechanics in the history of the world. I mean, it's hard out there. In the healthcare, it's hard out there. Because the end goal is you always want to help the patient, right? So if my job is, as a nurse, when I'm going out there and I'm doing my med pass or doing, treatments, when someone says I need a boost or I need to get transferred, I want to do it as fast as possible. And there goes my back. Oh, Jesus Lord. There goes my back. So it's good to hear. And it's really good to see. I love seeing it. Like when I walk into a room and I see a therapist move a patient, I'm like, yeah. I'm always like, that's the way it should be done. That's the way it should be done. Okay, so big goals. I want to know what is the end goal for you right now? You seem happy. You went to school. You went to OT school. You decided in 9th grade. Congratulations. Not a lot of people know what they want to do in 9th grade. You knew in 9th grade what you wanted to do. You chased it. You got it. You're doing it right now. Where do you see yourself growing? Do you want to go to another type of occupational therapy? Do you want to stay where you are and be an expert in that? Are you going back to school? What is the plan?
It's kind of a hard question for me because I thought so many things during school that I wanted to do, and I'm finding that that's not where I want to be, like stroke versus spinal cord.
Yes.
But ultimately what I want to do is learn as much as I can about the various fields and diagnoses and, keeping up with doing the best practice for the patients. And I also really enjoy being able to teach other people about OT.
Oh, you do?
I do.
Are you one of them, the therapists that get the newbies often?
Yeah, I have.
You have gotten, yeah. So it's like that's a thing. So I've only had one preceptor. I don't know what the correct way of saying it is, but I was a preceptor for one nurse, and I have to say it was the best thing and the hardest thing all in the same time.
Yeah.
Right. So let's talk about that a little because I think that's super interesting. I find that a lot of healthcare providers are really, really, really good teachers. I just feel like as a good healthcare provider, you got to be a good teacher because it's what you're doing every day with your patients. So when you have another person follow you all day, it just comes a little bit natural. Right. What do you like about the teaching of other, new occupational therapists, and what don't you like about it?
I'll start with what I don't like. I don't like feeling like I'm kind of all over the place trying to teach them for example, if you're starting a new job, making
yes.
sure they know everything about the new job and getting all the small details down, because then, if they're not doing it, you feel kind of responsible for it.
I hear that's the truth. That's the truth.
But what I like about it is that you get to brag about what you do to somebody else who's interested.
At least you're honest. At least you're honest.
Yeah.
I mean, it's the truth. Okay, keep going. I'm sorry.
With a student, you get to show them how great OT is and how rewarding it is to work with people every day and see their progress. And then with a new employee, you get to show them how great your hospital is and coworkers and things like that.
Yeah, and it really is true. So for me, I just digging a little deeper in what I don't like about being a preceptor is that it's okay. What I love about it is that they always asking me questions, and it's making me do my job. Like I'm never a better nurse when compared to when I have someone with me, right? When I have a student that's learning from me, a new employee that's learning from me, I'm like, I am the best nurse ever. And it's, of course, right? It's just human nature, right? You want to teach them the right way. You want to show them the absolute right way. No cutting corners, no little tricks here and there. But what I don't like about it is I never know when to let them go, when to let them do all of it, when to let them do half of it, when I should stand there and watch them, when I should be in the next room and say, you do that and call me if you need help. Yep. When do you get that? Because I feel like an occupational therapist, there's a lot of, there's a lot of place for injuries to happen. Mm-hmm. Like all day, what you do, there's a lot of injuries that could happen. Yep. How do you know when to let your eggs, your little chicklings fly?
I think it's hard for all the different aspects. For example, with a patient, you kind of learn how they do things, and then you can see that they're getting better at this, and you start to back off. But I'm always worried about making them independent, because then there's the risk that they could fall or something could go wrong. And I think, with a student and an employee, you kind of learn as you go, and it's a little bit different for everyone.
Of course it is.
But you kind of just, you can see them doing really well in this area, so then you move them on to the next area.
Do you ever, there's been very, 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 very few times that this has actually happened, but there's been I can remember one situation because it was my patient that they were moved to modified independent. For those who don't know, modified independent is someone who can do things on their own. They don't need a nurse to be with them, and they can do their own thing, right? So there was one situation where a patient was switched the day before to modified independent. They just had to use their walker. The patient chose not to, and they ended up falling. How much responsibility do you as a therapist take? As an occupational therapist, how much is that on you?
I take things kind of personally, in general, so I would feel pretty responsible, and that's one of those cases where I'd feel kind of nervous making them independent. But depending on the person, you also have to think about what are they going to do at home.
Exactly.
You're not going to supervise them for the rest of their lives, so it's always their choice. We make choices every day on what we want to do. And it's their choice whether they want to listen to our recommendations or not.
And that's the truth. Mm-hmm. That is the truth.
And it can be sad because then when they don't, you're trying to teach them the best way, and they don't want to take that suggestion, that, it makes you feel bad. And
it really does.
Yeah.
And it's like, this is going to help you, I promise, mm-hmm. but it's hard. All right, so let's talk about teamwork, right? Because where we work, it's literally team-oriented all day, every day. And as a nurse, having OT do a couple of my showers, oh God, it makes the room smell better, makes the patient feel better, it makes the day better. It makes the day better. And I know you are a tag team, you have a partner, a physical therapy partner, and you guys work on the same patients all day, and you guys communicate really well. Tell me a little bit about your unit and how you guys work together to make sure that the patient has the best outcome.
I'm biased because I only worked on that unit, and I'm sure the other units run this way as well, but I think that we all, nurses and therapists, have a really good relationship.
Which is the goal. I mean, that's, ladies and gentlemen, that is the goddamn end goal, okay?
I think a lot of us can be kind of friendly outside of work or even when we're in work about non-work things.
Yes.
And you develop that rapport with people that makes it a lot easier for all of us to do our jobs. And communication is huge, but I think part of it too is kind of helping each other out, like you say. So if you really need this patient to do a shower, but it wasn't what I was going to work on, maybe I'm going to do it for you because, we're friendly and you've done something for me before or whatever it is.
So that's super, super important because there's a few times where I have to interrupt therapy. When I say a few, I mean many. I mean, it's the truth. I'm just trying to be as honest as possible here. So we do interrupt you guys quite a bit. And when someone comes to a rehab hospital, the key is rehab. So can we just be real? I'm a nurse, you're a therapist. Let's do this right now, right here. Can you just break down a few things nurses do? So for me, specific, as like me, cue the nurse, specific moving forward, I won't do this anymore. And for the nurses out there watching, and the therapists out there watching, tell me, like, real talk, Tiff, real talk. What do nurses do that really grind your gears? Let's get into that, because I'm telling you, as soon as you're done, I'm going to let loose. I'm going to let loose.
When we can't respect each other and work with each other on something, that's what bothers me. So if you come in the room and step in between us and start popping pills into the patient's mouth, or they're in the middle of walking to the bathroom and you're like, here, I need to hook up this IV. That's enough to make me crazy.
Okay, all right. So when you say communication is huge, right? So you do understand when a nurse comes in and gives a medication, it's not like, oh, I decided that this would be the best time for the patient. It's like we do need to prioritize, number one, but number two, if there is an immediate thing like a medication that needs to be given at a specific time, we don't have much leeway, right? For there's very specific meds that we have literally a 30-minute window, and if we have 5, 6 patients, it's really hard to not miss that window and not interrupt all therapy at the same time. So if I come into the room and you are doing therapy, versus me just literally going and giving the medication, saying, oh, like I'm going to do this real quick. If I just say, can I? Is that enough for you? Or are you saying that you want someone to have a conversation with you prior to you even going in there?
No. And you don't even need to say, can I? If you come in and the patient is pulling up their pants and you're saying, here, take this medication, that's kind of, just wait a minute. Course. But if you come in and you say, hey, Tiff, I have this medication for this patient, I'll say, okay, let me just finish this and have them sit down. Even if they don't have their shirt on, but they pulled their pants up, I'll let you cut in type of thing. Okay.
So is that all you, is that like the main problem? Is there anything else? All right, I'm going to let you think while I talk, because I got a few things to talk to you. And this is specific to, yes, it is specific to OT, but it's also physical therapy, respiratory therapy, any kind of therapy. Anyone in the room that is not a nurse, I have a problem with you. Okay, so there's a lot of things. Like if you are a therapist and you're in the room with a patient and that patient says, I need to go to the bathroom, if that therapist leaves the room, and if they're there for 30 minutes, they came in at 8:30 and they're supposed to leave at 9, the patient needs to use the bathroom at 8:45, and you leave the room saying the patient needs the bathroom, and oh yeah, Q, your patient needs to use the bathroom, I'll be back when you guys are done. Fuck you. I'm just going, I hate it. I hate you. I hate it, the whole thing. I hate you. Okay? Because I don't care what kind of therapy you are. If you are a respiratory therapist, if you're a speech therapist, and you don't know, and like, okay, I get it, can you help me take this patient to the bathroom? It's very different than take this patient to the bathroom, I'll be back. That's number one. Number two, when you guys...
Wait, let me go on that one.
Okay, please.
So on that one, that's a huge pet peeve of mine as well. And whenever somebody comes in new to the hospital, I will always say that you have to be nice to the nurses. You have to work with them and do what they need to do, and they, you guys, we're on a timetable, yes. We're here 8 to 9, 9 to 10. But you are too with medications and with other tasks that need to be done. And I have personally witnessed our medical director bringing someone to the bathroom. So there's no reason that any other clinical staff member can't bring someone to the bathroom.
Exactly.
And honestly, it's taking away from nursing to give that time-sensitive pill or to do that other thing that they need to do. You heard it. She said it. She said it. Okay, and another pet peeve of mine, and like, I don't know what unit I went to when this happened, and I'm pretty sure, because you work in the same unit as Allie? Yes.
Yes. So I remember seeing her face that day, but I transferred. I was floated to that unit, and I swear to God, this literally made me the happiest human being on the planet. There has never been a faster... For those people who work at places where the staff on the unit don't pass out the trays, you don't know what I'm talking about, but where I used to work, we had to pass out the lunch, dinner, breakfast trays. I went on the unit, I literally went into a room for like 5 seconds. I took one tray, went into the room for 5 seconds, took a temperature, came out, and the goddamn thing was empty. I was flabbergasted. I thought that was the greatest thing on the planet. Because I don't expect all of clinical staff, all of the staff in general, to pass out the trays and get them ready and feed them. But the bare minimum is, if you're not doing anything that moment, and the dinner trays are up, or the lunch trays are up, if you can just take literally just one tray and put it in the patient's room, if you don't know if they can eat it, if you don't know if they're diabetic, just ask the nurse, ask the nursing staff, whatever. If you could help pass out the trays, I'm just saying, I was very, very happy, and it was easily the fastest I've ever seen any trace get done, easily. So that's a big kudos to your team downstairs. This is 2 South.
2 South, yeah.
2 South. Congrats. I'm just shout out to 2 South. You guys, you changed the way I looked at dinner and lunch trays. Okay. And I think that's basically, it's the little things that you can do outside of exactly what your job description says that helps the nurses, right? Because the nursing has to be with the patients all day. We have 5 patients, 4 patients, 3 patients, 7 patients that we have to be with all day. And we have to take care of everything that isn't taken care of by the doctors, therapists, the respiratory, the whole 9. Everything that's not their job specifically, we have to take care of. So every little thing you guys do extra really, really makes me smile, right? It just makes me happy, like, to not pass out an extra 6 trays. It makes me happy if someone went to the bathroom and then the therapist is like, oh yeah, he's in, like, even if you take him in the bathroom, he's in the bathroom, great, thank you, right? He had a bowel movement, he's, wet, whatever. All of these things make me happy.
And it makes our job easier too, because then it frees up your time to give a medication or to do a dressing or to attend to this person that isn't looking so great. And I mean, that makes it easier because then you're not stalling on your next patient that I need to see.
Exactly. Teamwork makes the goddamn dream work. All right, we're going to wrap this up, but I do want to know some stories. I know we're not supposed to say, allowed to say, I want to know, you told us the mini story of what got you into OT, right? As an occupational therapist, has there been a moment, or a day, or even a thing that happens often with different patients? What is that thing that really makes you feel like, oh my God, I love my job? And then on the flip side, what do you absolutely hate about occupational therapy?
I'll start with what I hate because I want to end on a good note.
That's a good lady.
It definitely bothers me a lot when people don't want to listen to your suggestions, don't want to care for themselves, type of thing. When you know that you can do this one simple thing that's going to make the rest of your day so much easier, or they just don't really care enough to take care of themselves.
So I want to be devil's advocate with that specific thing. I have to say, as a nurse, because I get to have these deep conversations, because I don't have 30-minute time brackets with patients, I get to sit down and have lifelong conversations with them. A lot of the time, when I go into the room and the patient's like, these fucking therapists, they think that I'm going to go out and buy myself a new bar in my bathroom. They think I'm going to be able to afford the toilet seat and the pill box and the step ladder and the grab bar. I'm not going to buy any of that. I can barely get my medication. Is that something that comes to mind when a patient says, no, I'm not going to do that? How do you... And are you speaking specifically about they don't want to use the tools I tell them to use, or are you saying just in general?
More in general, they're not going to stop eating that unhealthy thing, or they're not going to take this important medication.
Yeah. So
the equipment, I can totally understand. The medical supply companies' prices are ridiculous.
They really are. And just side note, for all patients, all human beings out there, that if you ever have to go into the hospital, I hear you and I feel your pain, because that's literally, outside of pain, number 2 is I cannot afford X. It doesn't matter if it's a medication or a device or whatever. That's the 2 things I hear the absolute most from patients. This hurts and I cannot afford to do whatever. So.
Yep. So I'm always telling my patients to go on Amazon or senior centers. They let you borrow things. And if someone were really stuck, then we would work with them and kind of have a conversation to figure out the best way.
I love that. I absolutely love that. Saving money in any way, shape, or form, good. Because healthcare is expensive as all hell. And then now, your favorite thing about being an occupational therapist.
My favorite thing is when you're able to help somebody progress and get better to whatever point that is, and having them be so happy about that. So, for example, I had a patient who had a pretty extensive back surgery, was an older person, and when they first came in, it took like 3 of us for this tiny person. They weighed nothing.
Yeah.
3 of us to get them up and out of into the chair. And some places we were lucky enough that we got to keep this patient for a longer time. But some places would just give up and say, that's
long-term
it
care,
is what it is.
Deuces,
Yep.
You can't do it.
Exactly. And we just kept working with the patient and each day telling them how great they were doing and really motivating them to keep at it.
Yeah.
And they left walking
I think that's
out of the hospital, doing, back to being independent.
And like, I don't know yet. Like I said, I've only done orientation, but what I hear at the hospital that I'm starting at is the length of stay is they want them out in under 4 days, 3 days plus, but under 4. And we worked at a place where, the average stay was a week and a half, 2 weeks, 3 weeks. They could stay as long, some patients would stay longer, but that progression is something I am absolutely going to miss. Mm-hmm. Right? Seeing a patient come in and like, fuck you, I don't want to do anything. And then leaving like, oh my goodness, I know all my medications. I can walk by myself. I don't need the alarms. Like that day where you come in and you tell me, I think this patient is good to get off the alarms. Number 1, I don't have to hear it no more. But number 2, I'm like, yes! And they're just even more excited because they don't have to have me stand next to them as they poop and pee. So it's like that progression is literally the greatest thing in the world. I call you an everyday hero. This is the Everyday Hero Show. For those young ladies out there, for those young gentlemen out there, and please, gentlemen, we need more of you in healthcare. I'm all alone. Come and join me. For all those people out there that want to be occupational therapists, do you have any advice for them to go into school? Do you have any advice to them who are occupational therapists? How can they better or have a better time doing their job?
I think just to keep at it, be determined, and just always remember that that person could be you or your family member, and you want to provide the best care that you can, no matter who the person is.
No matter who the person is, and it's really, really easy for you to it's easy to say, like everyone would say that, right? Everyone would say that, but in actual practice, it is super hard. And when you come into work and you're getting a report from someone, I don't know how it works specifically for OT, but when you're getting a report, if you're reading someone's medical history and on the history, they're like, oh, this patient, is difficult. This patient has this kind of issue. And then you already, you have these precept ideas on the patient, whether they deserve it or not, it doesn't matter. It's very hard to go into a patient's room, clean slate, and be like, I'm going to treat you as if you were my mother. It's very difficult.
And it's so frustrating when you go in and they yell at you and say, get the hell out, and exactly. I'm not doing any of this. And that's when, you go back, and like I said, we're all really close. You go back and you vent to your coworkers and talk about another way to approach them. And then maybe the next day they're feeling better and they work with you. And you can't go in there and be just mad at them for what they said. Exactly.
Because I don't want to break it to you. As important as you OTs out there, as you nurses out there, this is as bad as those 10 seconds you were getting yelled at. This is literally that human being's worst time of their entire life. Might be a bad 10 minutes for you, 10 seconds for you, but that's the worst time of that person's life. So give them a goddamn break. Last and not least, it's all over. It's all over. We're done. Yeah. Congratulations, Tiff. You've been amazing.
Thank you.
Just out there, for all of you folks at Health Stuff, I miss you. God damn it, I miss you. Come on the goddamn show. Please and thank you. It's out there. Anyways, I don't know if you're huge on social, but if you are, even if you aren't, and you'd like a couple more followers, the 6 people that watch this, my 6 friends, where would you like us to find you? Snapchat, Instagram, Facebook, LinkedIn, I don't goddamn know. What do you have something that you would want people to find you at?
Facebook or Instagram would be fine.
So I'm going to put her Instagram out there. I'm not going to put her Facebook out there. That's not going to happen. I'm going to put her Instagram. You can follow her, check her out. She's a cool beans, Tiff. I really do appreciate this. 5 years from now, 10 years from now, when you are running the spinal cord OT company of the universe, of the world, and I say, hey, Tiff, you remember Q? I used to work with you 17 years ago. Would you like to come on this show again? Would you do me the honors?
Absolutely.
You heard it here. She said it. I didn't. It's going to happen. Thank you.
Thank you.
And then for you folks out there, just in the description box below, please tell me if you're an occupational therapist, if you're a PT, if you're a nurse. Let me know the best moment you had with your patients. That is the question of the day. Outside of that, thank you. Please like and subscribe, and I'll talk to you guys later. Deuces.